Good evening, I'm Adrienne Arsenault. As we do our part to physical distance, I'm here in our new temporary home in downtown Toronto, while Andrew is in our studio. Tonight, deadly outbreaks at long-term care homes.
I got to tell her that I loved her. That was kind of my comfort.
At least 9 dead, dozens of staff sick at one Ontario facility alone. For families, it's terrifying.
A war zone without soldiers, and they need the soldiers.
I'm Andrew Chang. Also tonight, a big bailout for struggling companies.
We know what businesses are going through.
Ottawa will foot 75% of their payroll to keep them afloat.
We've been behind this virus from day one.
An urgent situation in New York. Hospital beds in Central Park and on a military ship as the governor pleads for more help.
And the mixed messages about masks.
It could be helpful.
You don't need a mask.
Should you wear them or not? And what about making your own? This is The National.
Health officials say this week or next we could finally see whether what we're all doing now, this physical distancing, is actually paying off, whether we'll be able to flatten the curve of COVID-19 cases.
But in the meantime, those case numbers are still going up. Today, more than 1,000 added to the list, and 26 more people have died. Some of them members of a particularly vulnerable group, seniors who live in retirement and long-term care homes. There are outbreaks of this coronavirus in such facilities across the country. Now, in the small community of Bobcaygeon, Ontario, an outbreak at one long-term care home has led to incredible loss. At least 9 residents have died after getting the virus. Ellen Morrow shows us the pain now left behind.
Inside these walls, a tragedy is unfolding.
And I'm just going to miss her like crazy. Sorry.
Pamela Smith lost her mother, Jean Pollock. Pollock didn't live at Pinecrest, but she visited her husband there every day. It's believed that's how Pollock caught COVID-19. She died in hospital over the weekend.
And I got to tell her that I loved her. And she opened her eyes. The nurse said, oh, she's opened her eyes. So that was kind of my comfort.
9 Pinecrest residents have died, a number expected to rise, and at least 24 staff members have the virus. It's not known how it got into the home.
It's heartbreaking. It's heartbreaking. It really is.
Sarah Gardner, a longtime nurse, was there over the weekend.
We're losing them, and they can't even see their family. It's a very lonely situation for the residents, and that makes it very heartbreaking.
Ian Hanscombe and his mother visit his 85-year-old father, Bill, every day, but only through his window. Bill hasn't shown any symptoms, but that does little to soothe the nerves.
That is the hardest thing that we have had to do, is the anxiety of waiting and the feeling of helplessness.
And with so many staff members ill, Hanscombe is pleading for more help.
A war zone without soldiers, and they need the soldiers. They need some caring people, even if it's just to hold their hands and say things, are gonna be okay.
The only solace for Pam Smith, knowing her mother doesn't have to see the pain.
She loved the people that worked there and definitely loved the residents there. She would be devastated that they're going through what's happening there right now. She would just be gutted.
Ellen Morrow, CBC News, Bobcaygeon, Ontario.
So that is the most feared situation for people whose loved ones live in seniors and long-term care homes. As David Common shows us, that is causing some of them to act and advocates to call for changes.
In ordinary times, PJ Kwong is a figure skating commentator, but right now she's looking after her 93-year-old mother-in-law after pulling her from a care home.
Let's face it, the statistics as far as people dying from COVID have been particularly stark where it comes to people in long-term care facilities.
Kwong loves the home staff, but when one became infected with COVID, she knew she had to act. Across Canada, at least 30 seniors' homes are facing cases, including outbreaks at Lynn Valley in North Vancouver and Landmark Village in Sarnia, Ontario, where 3 residents have now died. In the U.S., Johns Hopkins University says families could be encouraged to take residents home if they can manage them for an extended period, though the Centers for Disease Control warns infected seniors may well not show symptoms. Part of the reason this elder advocate wants every resident in an affected home to be tested, though she says that isn't happening in Ontario.
Once a home has an outbreak, they just presume that everyone in that home who starts showing any kind of symptoms has COVID-19, and they will treat it that way.
At others, the infected are isolated and visitors banned.
We're putting an iron ring of protection around our seniors.
But staff in Ontario have been working at multiple facilities. In the past, says this advocate, that's amplified outbreaks.
So then you have staff going back and forth, and that's who is going to be probably bringing it from home to home.
She matters more to us than anything I could possibly imagine.
Meanwhile, the rules are being changed in Ontario to allow those like Kwong's mother-in-law to be top priority to get back into their home when all this ends. David Common, CBC News, Toronto.
Now, across Canada, there's little sign the threat from the virus is receding. Quebec alone reported nearly 600 new cases. Doesn't look like the caseload is leveling off there just yet. Ontario is reporting at least 360 new cases. That increase a result of labs working through a backlog of testing. And among Canada's growing toll, Newfoundland and Saskatchewan confirmed their first fatalities as hundreds of other patients fight for their lives in ICUs across the country. Now, just how important those beds and ventilators are, well known by now. But Vicodopia takes stock of just how long we have left to slow the virus before a grim math starts to take hold.
Geared up for the front line, this BC doctor took to YouTube after a weekend of tough decisions in the ER.
If I see you in my department and you are clinically stable, your lungs are functioning normally, I'm going to be sending you home and directing you to self-quarantine for 14 days. And that scares me.
Scared that they won't self-isolate and in turn infect others. This week, BC is waiting to see if new cases have leveled off, but still getting ready for the worst.
And being prepared for the most pessimistic of the models. All the health authorities will be preparing off-site treatment centers.
How this week unfolds relies on how well Canadians have been following physical distancing, adopted by most provinces more than 2 weeks ago.
There are still people out there who really have not grasped the gravity of this situation. This is not a game.
In a poll, when asked if they considered COVID-19 a serious threat, Canadians have been slowly coming around, but 12% still think it's overblown. Today, Canada's Chief Public Health Officer warned against complacency.
Even if you're not hearing of cases in your community, it doesn't mean that there are no cases or that there are no exposures waiting to happen.
In Ontario alone, COVID-19 cases are already starting to tax ICUs, and unless the rate of new cases drops soon,
there is definitely a potential that our healthcare system will become overwhelmed over the coming 2 or 3 weeks.
Unless there's more testing and physical distancing, this doctor fears we'll share the same fate as places that have failed to control the outbreak.
I think we have to unfortunately look more to the countries that haven't done as well.
And health officials say this week will be critical in determining the course of Canada's outbreak. Vicodopia, CBC News, Toronto.
Okay, so let's bring in infectious disease specialist Dr. Lenora Saxinger. And we heard a few times there how crucial the next 2 weeks will be. Why is that?
I think that we're really having a lot of anxiety about what's going to happen, and there is no crystal ball for what's going to happen, but there are signals in a lot of areas that we could be seeing really intense uptick in hospital admissions and ICU admissions. That's happening already in Ontario, and we're following along in Alberta and other places. At the same time, there's communities that are not seeing that much evidence of spread, and the overall message is for everyone to continue social distancing. And it becomes very hard when you're feeling fatigued of it already and you're not necessarily seeing the impact of the disease in your community. I think that there's some risk of losing people's, I guess, zeal and interest in continuing to distance. And any any extra transmission during this time could make a very, very significant difference in the number of eventual cases and the ability of our healthcare system to deal with them.
All right, Dr. Saxinger, thanks very much.
The Prime Minister added crucial details to a plan announced last week to subsidize Canadian wages. This isn't about workers at smaller businesses anymore. As David Cochrane explains, it's about trying to save every job in every industry in the country.
I know there's a lot of people suffering.
Stephen Lee has a lot on his plate, even though the plates and tables in his St. John's restaurant are empty. This location is takeout only. His other closed entirely. So is his boutique hotel.
Of our roughly 80-person workforce between the three businesses, we've laid off 65. So we've been able to retain 15 staff between the three businesses.
We know what businesses are going through.
So in a time of big support programs, the biggest one yet, a massive escalation from initial attempts to help businesses. It's now a 75% wage subsidy of up to $847 per week per employee, and it's not just small businesses anymore. Companies of any size qualify if their revenue has dropped by 30% or more. That includes nonprofits and charities.
To help Canadians keep their jobs, stay in their jobs, even if they're staying at home.
The subsidy will even go to companies that are completely shut down and ones that are open but lack the revenue to pay the top-up.
If you have the means to pay the remaining 25% that's not covered by the subsidy, please do so. And if you think this is a system you can take advantage of or game, don't.
It amounts to the nationalization of Canada's payroll to keep people on their own payroll, so businesses like Stephen Lee's can reopen quickly once restrictions are eased.
Well, it basically, guarantees our bounce back. If it wasn't for the subsidy related to payroll, I don't know we would be able to wait it out to see if it was viable.
A lifeline to better times when people can get out of the car and come in for a meal. David Cochrane, CBC News, Ottawa.
The newly announced wage subsidies were apparently not a factor in Air Canada's decision today to temporarily lay off 16,500 workers. The airline says the furloughs will hit both management and frontline workers and last at least through May. That's on top of more than 5,000 flight crew who were laid off earlier this month. Air Canada is also grounding about 90% of its flights, including most of its international and U.S. routes, due, of course, to COVID-19.
And as people are losing their jobs, the first of the month is less than 2 days away. It's the first rent day since the pandemic really started taking hold here in Canada. Provinces have put a freeze on outright evictions, but many renters are still wondering how they're going to make ends meet. Farah Morali looks at how it's playing out.
So Jackson is 3.
Carla Mount Stevens' job these days is finding creative ways to pass the time with her son.
Big splash!
The dance school where she worked as an administrator on contract is now closed. She got her last paycheck 2 weeks ago, and on the 1st, it'll be gone.
I have the money in the bank right now to pay my April 1st rent, but that's it. So what about, feeding my son and paying my bills? And I don't know how long this is going to go on for, and that scares me.
Mount Stephen will qualify for the federal government's new Canada Emergency Response Benefit, but she can't even apply until next month. The Ontario government has urged landlords to be flexible with tenants who are struggling and has said no one will be evicted, but isn't providing direct financial help.
We'll be providing a $500 a month package to help renters up to $500 a month.
BC, on the other hand, is offering cash to help, paying landlords directly. But there's no guarantee it'll arrive before Wednesday.
We've still got to pay rent on the 1st, and I don't really know how I'm going to do that.
Posters like these have now popped up in cities like Toronto, calling on renters not to pay.
Families like ours that we depend on that income.
But for some landlords, that's the only money they have coming in.
And my husband owns a business, so he has had to close his doors too. So just a little uncertain.
More than 840,000 people have now signed online petitions asking for a rent and mortgage freeze for April 1st.
Having fun digging.
For now, Mount Stephen says all she can do is wait for the federal benefit, but that won't help her on April 1st.
Being a single parent is a struggle on its own, and I think being a single parent now in this time is hard.
Farah Morelli, CBC News, Toronto.
We all know the pandemic is developing differently depending on where you live. So Anita Bath is tracking stories from communities across Canada for us tonight.
Adrian, let's start with Ontario this hour. Frustration in Toronto over people not staying home and finding ways to get into parks to play sports.
Having climbed over fences and gates that were locked there to keep people out during this health emergency.
Our bylaw enforcement officers working together with police, working together with our parks ambassadors, going to these hot spots. The set fine is $750. It could go as high as $5,000.
Windsor, and there's concern that's tied to a spike just across the border in Detroit. Around 1,500 healthcare workers cross over to Michigan. Now a local MP is calling for segregated housing for those nurses or asking they be required to stay in the U.S. during this time. In Quebec, 600 new cases today and 3 more deaths. The premier says the outbreak is taking a toll on people's mental health, especially those who work at essential stores.
Businesses will now be closed on Sundays, except for gas stations, pharmacies, convenience stores, and takeout in restaurants. It will be an opportunity for our workers to get some rest.
Quebec has also announced $133 million in emergency funds for seniors' residences so they can hire more staff, buy protective equipment and disinfectant. Adrian?
All right, thanks, Anita. A plea for help tonight as New York braces for the worst.
We've been behind this virus from day one.
Up next, makeshift hospital beds in Central Park, a floating hospital in the harbor, and a sudden change in the message from Donald Trump.
All this happened so fast in my 3rd trimester.
Why expecting mothers are suddenly worried they may have to give birth alone.
And should you really wear a mask?
Maybe that's the way that we should be heading.
We try to clear up the confusion. We're back in 2 minutes.
During the COVID-19 pandemic, Canadians have seen a growing list of social restrictions, and overwhelmingly most comply. But in Quebec, a close-knit community is volunteering to lock down. Alison Northcott explains why.
To get in or out of the Hasidic community of Tosh, people now have to pass this checkpoint and can only come or go if it's essential.
The members of the community are doing the checkpoints, but our police officer can help them if they need help.
They asked to be isolated after at least 15 people tested positive for COVID-19. Their goal is to prevent a bigger outbreak from sweeping through the community and affecting neighbors.
No synagogues, no meetings, no schools. Everything is locked down.
Public health officials call it an extraordinary measure.
It's quite an intervention. It's maybe the most difficult decision in my life, but it's really to protect the member of the community and protect the member of the community surrounding them.
Tosh is an ultra-Orthodox Jewish community within the Montreal suburb of Boisbriand. One community leader says they became concerned after residents who had returned from celebrating the Jewish holiday of Purim in New York earlier this month started coming down with symptoms.
We don't have any outbreak like it's in Montreal or any other area. We still wanted to be responsible, so we asked the government help us do a lockdown so we control the community, we make sure we protect our neighbors and everybody else.
He says Tosh has followed all public health orders and more, but he worries about stigma.
We ask the neighbors to be the same kind to us as we are doing. Please give us that, understand it.
Police say they checked in on schools and synagogues in the community last week and that all of them were closed. And for this community with large families used to congregating, that's been a big change.
People are emotional, the emotions are high. They understand that safety is the most important thing, and everyone knows that they're doing the right thing, both to humanity, to themselves, and to God, by adding another layer of safety.
Public health officials say they expect more cases, but are confident the measures in place can keep them under control. Alison Northcott, CBC News, Montreal.
Weeks after members of that Quebec community were exposed, New York remains the epicenter of the American COVID-19 outbreak. The U.S. has now confirmed more than 160,000 cases, and as of tonight, more than 3,000 people have died, 1/3 of them in New York alone. Healthcare workers on the front lines are exhausted. And as Susan Ormiston tells us, New York's governor admits they are struggling to keep up.
This is no drill. A U.S. Navy hospital sailing into New York with 1,000 beds, not for COVID patients, but to free up space in other hospitals overwhelmed. But look at this, craning to see that ship jammed together in the worst hotspot in America. It's a deadly battle. In the heart of it, Central Park, a small field hospital going up, hard to fathom.
We've been behind this virus from day one. The curve goes like this, you're over here. Prepare for the high point of the curve and do it now. When are you going to do it, the night before?
Cuomo pleaded with doctors and nurses from other places to come as fear grows that infection or exhaustion will fell frontline healthcare workers.
We are scared too. We're fighting for your lives and we're fighting for our own lives. We're trying to keep our head above water and not drown.
There's no escaping the climbing numbers nor the urgency to ready for a peak maybe weeks away. The National Guard in Baltimore making a hospital as the U.S. Capitol and neighboring Maryland and Virginia force residents as of today to stay home, meaning more pressure on delivery workers and others to keep going. Today at one New York Amazon warehouse, they went on strike to demand more sanitation and hazard pay.
We just feel unsafe. As far as we can see, there's been so far 8 confirmed positive diagnoses of the coronavirus.
Trump is urging another month at home now, a stark reversal from raring to go by Easter. And if it works well, his calculation?
We could save more than 1 million American lives. Think of that, 1 million American lives.
It is a head-spinning contrast to just a week ago when President Trump wanted to open up the economy very soon. Today, he said he may even toughen up the guidelines a little more. Susan Ormiston, CBC News, Washington.
Well, another ship is headed for the U.S. coast, a luxury cruise, which has turned into a nightmare for about 1,200 passengers, including more than 200 Canadians. 4 people have died on board, hundreds more have symptoms, and now it's far from certain if any port will even let them dock. Cameron McIntosh reached some passengers as their ship headed for Florida.
We've been in this room for 8 days.
And Bob Roerson and his wife don't know when they're getting out. Stranded aboard the MS Zondam, now pointed for Florida. Still looking for a port. Confirmed cases of COVID-19 and 4 dead aboard.
There are people on this ship that are sick. There are people on this ship that are much older than we are, and they're stuck in their rooms.
The Zondam is one of 18 cruise ships stranded at sea. The cruise line isn't saying how 4 passengers aboard died, but confirms cases of COVID-19 aboard. None of the 247 Canadian passengers have officially been diagnosed. Over the weekend, about half the passengers, including 150 Canadians, were transferred to a sister ship to separate the ill from the apparently healthy. 97 Canadians were left aboard, some showing symptoms. Roerson and his wife so far have none.
You know, you're quite isolated. We don't talk to anybody.
Yesterday, the ship was allowed to pass through the Panama Canal. Precautions clearly taken. In a message to passengers, the cruise line says it hopes to dock in Fort Lauderdale.
We can make our way through the canal and work our way towards our next part of our journey, which is getting you to a place where you can now make your way home.
Authorities in Florida haven't made a decision. They aren't keen.
Or have a cruise ship come in, it creates problems, and we want to focus on Floridians.
Chris Joyner is hoping Canada can work out a deal similar to one that brought passengers home from a ship that docked in California.
Is there any ways and means of creating a safe corridor for the passengers so they can get onto perhaps chartered planes and just get the hell out of the state? This is absolutely humanitarian. We need to get off this ship.
The Canadian government is one of several working with the cruise line to bring passengers home, so long as there's a port willing to accept the ship. Cameron McIntosh, CBC News, Winnipeg.
Around the world, COVID-19 is taking its toll. The number of coronavirus cases in Spain has surpassed China's. Flags were at half-mast in Madrid today to honor the victims. More than 7,300 people have died in Spain. 85,000 have tested positive. China saw 81,000 cases. A military aircraft brought health supplies from Shanghai to Madrid, and Spanish police have begun using a water cannon to sanitize streets. And life in Wuhan is returning to normal. One of the city's biggest malls reopened to the public today. Shoppers did not seem to mind having their temperatures taken before entering. They're also being asked to wear masks and keep their distance from each other. There are still more than 100 severely and critically ill coronavirus patients in Wuhan. They are all being moved to one hospital for concentrated care. And in the UK, Prince Charles is out of self-isolation after being diagnosed with COVID-19. The 71-year-old heir to the throne is said to be in good health. Meanwhile, Prince Harry and Meghan Markle are officially signing off as working members of the royal family. In a statement today, they acknowledged the pandemic, writing, "We're focusing this new chapter to understand how we can best contribute. While you may not see us here, the work continues."
Okay, in just a few moments, we're going to put your questions to a pair of doctors. Questions including, can I safely cook or bake food for friends? Does the heat involved kill the virus? The answer is actually a little bit surprising. But first, over to Adrian.
So after about a week of hosting the National from my back deck, you might be wondering why we've changed things again. The short answer, it just makes more sense. With the condo, we combine a studio, an office, and if need be, a living situation. Worst case, we can hunker down for as long as it takes. And it's not just us overcoming challenges. Obviously, our colleagues are doing such great work covering COVID-19 in spite of COVID-19, like key staff producing this show from home every night, or CBC reporters conducting interviews while physical distancing, or scrambling to put stories together from their kitchen tables. A closet works perfectly well as a recording booth in a pandemic. All to say, it doesn't matter where we work, the National is with you, and we're not going anywhere. Welcome back. Canadians have so many questions about the COVID-19 crisis. One we hear again and again is about whether people should wear masks. Now, the responses are anything but consistent. Salima Shivji tries to sort through the mixed messages.
It's just a simple cloth mask.
It's not the advice of Canadian health officials, but Arena Stonechild has taken matters into her own hands, worried with the virus spreading in her community.
I decided that masks were a good idea. And out in the public, random people come up to you, and they're not always good about social distancing.
She made it herself, a movement that's growing globally as a push for masks for all takes hold, led by the Czech Republic, where it's mandatory.
I protect you, you protect me.
And being credited with helping to flatten the curve there. Austria is now forcing grocery shoppers to wear them, and a Toronto hospital also put a call out for locals to help sew masks, even though the medical evidence that they work is mixed. Still, some say, why not just try it?
In high-risk situations nowadays, repatriation flights, perhaps grocery stores or busier areas, maybe that's the way that we should be heading.
A research team at Oxford looked at how every country is using masks and says COVID-19 is an unusual case where masks can help because people who don't show symptoms can also be highly contagious.
If the supply permits, if everyone wears face masks, it could also be helpful to control the disease spread.
And yet the message in Canada is consistent. Don't bother.
I would prefer that people kept the 2 meters as compared to the mask.
You're not sick. You're going outside. You don't need a mask. Please, wash your hands.
The main concern is supply, with healthcare workers the priority. But there's another factor. Masks don't cover your eyes or other vulnerable areas.
And that gives you a full sense of confidence, but also it increases the touching of your face.
The conclusion here, for now, wash your hands instead. Masks aren't worth it and could make matters worse. Salima Shivji, CBC News, Ottawa.
Well, it is that time of the program where we put your questions directly to a team of doctors. Tonight, we've got infectious disease specialists Dr. Lenora Saxinger and Dr. Isaac Bogosh. Hello to the two of you. Dr. Bogosh, we'll start with you. And granted, this first question does get a little bit into the weeds, but here it is. When you come home and you wash your hands, you turn on the faucet first. Then once you've finished washing your hands, you're touching that same dirty faucet. Are you recontaminating your hands this way?
You know, I think in situations like this, we have to draw the line somewhere. And you're doing a great job by washing your hands with soap and water. Of course, you have to turn that faucet off. In a perfect world, these would be automated, but you know, that's clearly not available everywhere. So I think we just have to draw the line, wash our hands with soap and water, turn off the tap, dry our hands, and move on with our lives.
I actually would add one thing, which is when you're looking at how faucets are designed, a lot of them actually, if you can turn off with another part of your forearm or your elbow. And if that's a possibility, you can avoid the recontamination of your hands. And I might be on the kind of more OCD part of the spectrum, but I actually do wipe down faucet handles and doorknobs and other high-touch surfaces a little bit more frequently now. And I include doing that when people are ill in the house.
Okay, good to know. Next question, Dr. Saxinger. Can I safely cook or bake food for friends? Does the heat involved kill the virus?
I think that heat aside, that it's generally felt that food is not usually a vehicle of transmission of this virus. And so you really get it from an infected person in a much more direct way or from surfaces that they have touched. And so to me, the more important question is, how are you packaging that? What type of packaging is it? How clean is the packaging? And serving utensils are often a consideration too. You don't want to have shared serving utensils, so to me, it's all about the plating and the handling of the packaging, not the food itself. And so it should be something that people can deal with.
Okay. Dr. Bogosh, next question for you. I'm trying to self-isolate, but I live with an elderly parent who needs my help. How do I care for them?
Yeah, this is a very challenging situation because clearly we know that the elderly are certainly prone to having more serious infection. But of course, we know people are in the situation where they have to care for an elderly relative as well. And everything should be done to ensure that this individual does not get infected and bring this infection back home and infect their elderly relative. So that means impeccable hand hygiene and also being very mindful if this individual ever comes down with any symptoms whatsoever, they should certainly avoid all contact with their elderly relative and find other people or other mechanisms to help that elderly relative out, because we have to do everything possible to prevent them from getting this infection.
Similar sort of a question, Dr. Saxinger. I'm dating someone. Are we really expected to act like we're in a long-distance relationship until this all blows over?
I guess this actually kind of forces relationship dynamics a bit, because I think most of us accept that if you're in like a household and you define yourself as a household unit, you treat that unit as a kind of standalone when you think about how to interact with others, and you try not to go outside that unit. So if you consider yourself a unit, a household unit, then I think it's reasonable. And if you are not at that stage yet, I think that you should continue to socially distance. And that's a difficult time.
Time for one more quick one, Dr. Bogosh. Easter and Passover are coming soon, and families are planning get-togethers. If we self-isolate and social distance ahead of time, is there a safe way we can meet up?
This is also a challenging situation because I appreciate that these are special holidays and these are times where families would normally gather together and many people would get together under one roof. But I really think we're in an extraordinary time, and I think this year the only people who should be getting together are the people who live under the same roof. So this is not the time to be inviting other family members or other people over to your house for example, the Passover Seder or the big dinner for these holidays. I think it should only be restricted to people who live under the same roof together.
Okay, we'll leave it there. Dr. Bogosh, Dr. Saxinger, thanks so much for your time.
Anytime.
Thank you.
Now, as we've mentioned, we ask your questions about COVID-19 every night, so send us those questions. You can message us directly on Instagram at CBC The National, or you can send us an email at covid@cbc.ca and put The National in the subject line.
Up next, the uncertainty of being pregnant during a pandemic.
It's not easy to recover from a delivery and take care of a newborn.
Why some expecting mothers are afraid they may have to give birth alone.
But first, take a look at this. This is Gray Moonen, a family medicine resident on the front lines of the COVID-19 battle in Toronto. He's been using Twitter to highlight some of the unsung heroes fighting alongside him.
I wanted to bring a certain level of humanity to this crisis and put a face and a quote behind some of the people that are both directly related to healthcare and more peripheral to healthcare.
People like Nicole, a volunteer screener. She asks people if they're symptomatic before entering the hospital. She told Moonen, "It's a few hours of my day, so I figure, why not? Anything I can do to help." Then there's Amanda, a hospital pharmacy worker who said, "Honestly, I'm just too tired to panic right now. I've got insomnia to begin with, and now I can barely sleep. Public safety trumps my own comfort at this point, so I'm here doing what I can."
I didn't really see a lot of recognition or awareness that these people are still showing up to work and working very hard, so I thought they could use a little bit of recognition.
For couples who are expecting, COVID-19 has added a whole new level of anxiety. Health Canada does say there's no evidence right now to suggest pregnant women are at greater risk. But with so much talk of hospitals being overwhelmed, many pregnant women are worried about their deliveries. Kayla Hounsell explains.
This is how Maria Papaioannou begins each day, playing music to her baby while she catches up on the latest news.
All this happened so fast in my third trimester.
At first, her husband was told once she's transferred to the postpartum unit, he would have to leave the hospital. Now he's been told he can stay, but all the uncertainty is adding to the stress Papaioannou is already feeling. She's had some complications and will be having a C-section.
It's not easy to recover from a delivery and take care of a newborn. And what scares me the most, what gives me the most anxiety at night, is the fact that this could change once again and might be even more drastic, where they say, well, that's it, no visitors allowed whatsoever.
Some New York hospitals banned all support people during labor and delivery until the state forced them to reverse that decision. The World Health Organization is recommending one support person be allowed to be present, and that's what most Canadian hospitals are doing. Still, fear that could change and fear of hospitals in general is creating a spike in requests for home births.
They want to stay in that environment that feels to them sort of cocooned and protective, and they know.
But Nova Scotia has suspended home births to help prevent the spread of the virus. This midwife is opposed to that. She says with planning, home births are safe for low-risk deliveries.
We want that decision to be made in a way that people feel really comfortable with it and not out of fear.
This obstetrician agrees and says while COVID-19 is new, so far available research doesn't suggest pregnant women are particularly vulnerable.
With H1N1, we had really good data right from the outset that pregnant women were doing poorly when they became infected. We're not seeing that right now.
Maria Papaioannou is trying to focus on the positives.
As soon as I see her, I think that everything will just kind of blur out, and whatever I've gone through will kind of be a lost memory.
At the very least, she says, it'll make quite a story to tell her baby someday. Kayla Hounsell, CBC News, Halifax.
Next, a look at what it means to be homeless during this pandemic. What do you do when self-isolating is near impossible? But first, throughout Nova Scotia's COVID-19 ordeal, Chief Medical Officer Dr. Robert Strang has been blunt.
This is a serious disease that we all need to take seriously.
But also kind.
And we need to do the things we can all do together to protect each other by doing it in a way that cares for each other, that builds community, not tears down community.
A sentiment his neighbors took to heart by decking his street and driveway with signs of appreciation.
He's done so much, of course, keeping us informed. So we just wanted to show support for Dr. Strang and all the medical professionals.
Appreciation, Strang said today he returns, stressing he's just doing his job.
This coronavirus has certainly thinned out traffic on our streets and sidewalks, but in a way that's made homeless people more visible than ever. They often don't have anywhere safe to go. Nick Purdon caught up with a man who knows those problems firsthand.
I feel worthless even more. I feel like I'm a walking disease bank. And people avoid you already, but now they're avoiding you even tenfold.
That's Paul. He's 43. He's been homeless for 7 years, ever since he hurt his back and lost his job. Paul is one of nearly 8,000 homeless people in Toronto who live in shelters. He used to consider himself lucky to have a bed, but now with COVID-19, he's not so sure.
What's the situation inside the shelter?
It's dire. Tensions are high. Guys are upset, and it's understandable. Like everyone else would be too. When you're trying to stay away from the coronavirus, and you can't.
That's because inside the shelter, it's almost impossible to self-isolate. Imagine 60 men all sleeping next to each other in bunk beds.
If the guy next to you is sick, he's gonna cough on you immediately because you're 2 feet from his head. That's why bugs go around shelters so fast, because the beds are so close together and there's no space to hide from it, period.
Paul tells me his only chance at self-isolation is to walk the streets. But because of the virus, that's challenging too.
There's nowhere to go, absolutely nowhere. You're kicked out of every place you go to. Not just because you're homeless, but because of the pandemic that's going on.
You're kind of in an impossible situation.
It's past impossible situation. It's an inevitable coronavirus situation is what it is.
A few homeless people in Toronto have tested positive for COVID-19, and others await results. The city now plans to house people in hotels and other places to try to stop the spread. Roxy Danielson is a nurse in a health clinic for the homeless.
What's being done?
Right now we have assessment centers set up around the city, so if somebody's showing symptoms of COVID-19, they will go to an assessment center, and from there, if they do get tested for COVID-19, that person will go to an isolation center to await the test results.
What's at stake?
Their lives are definitely at stake. I have cried a few times at the thought of the virus spreading and killing many homeless people. I work with so many homeless people, and just the thought of people dying from this because, again, they don't have access to a safe place to live is really heartbreaking.
To make matters worse for Paul and all homeless people, the places they used to rely on, the soup kitchens, the churches, are all now closed.
What do you worry about?
Well, getting sick. Who doesn't? And then me, I do have friends and family. Like, if I get sick, I'm not going to be able to go near them, period. And I don't want to give it to them.
Homeless people were already in a tough spot before the virus. Now Paul is stuck between a shelter full of people or walking alone in the cold and hoping for the best. Nick Purdon, CBC News, Toronto.
Next on the National, the bells are ringing in Mahone Bay. How the community is reminding people that even in isolation, they're not alone. Our moment is next.
These three churches sit side by side in Mahone Bay, Nova Scotia. And for now, all three of them are shut down, all services suspended. But these churches want their communities to know that they're all in this together. So they've decided to ring the bells, a reminder that they're not alone. And that is our moment.
Just a reminder that we're all together, we're all part of the same community, that we're supporting one another, and even though we can't gather together as we normally do, on a Sunday morning, we can certainly support one another in different ways.
They ring 2 minutes each one, and then another minute all three together. That's the next best thing to being there, I guess.
You have folks that have also gathered with their own cowbells. It's probably one of the most difficult times that we've had, and also the times when I've been most proud of who we are as people. So doing what we can just to remind us that we are still a community. Bye, Donnie. Bye, Beverly. Thanks for ringing along.
All right, so some of those churches, Andrew, are saying that it's not so easy for them to do the online services, that a lot of them don't have the technical capabilities at this point to do that. So they're doing whatever they can, wherever they can, really like the rest of the country.
Right. And even those folks who do have the technical capabilities, I mean, it's not always easy to feel like you're together in this with other people, even if you can FaceTime or Zoom or Skype. And so, high tech, low tech, sometimes you don't even have to say a word. That's the National for this March 30th. Have a good night.